season will be stocked in outlets nationwide, ensuring our farmers are ready to plant, grow, and produce. This forward momentum will not only increase our agricultural output, but also reduce our reliance on costly food imports, securing a more self-reliant and a more prosperous Kenya. This approach, rooted in my administration's policy to support production rather than subsidize consumption, has already made food more accessible, more affordable to many households. Today, Kenya boasts substantial national stocks. 47 million bags of 90-kilogram bags of maize are in our stores. 8.8 million bags of beans, 10.4 million bags of wheat, and 2.1 million bags of rice. Slowly but surely, we are building a food-secure Kenya, where families need not to worry or worry less about their next meal. In the sugar sector, we have achieved a historic milestone. All 17 sugar factories across Kenya are now operational, producing at impressive levels, while 4 new sugar factories are under construction. In July alone, domestic sugar production reached 84,000 metric tons, surpassing the national monthly consumption average of 40,000 metric tons. For the first time in recent history, Kenya is producing enough sugar to meet our local demand. This success is attributed to many factors: subsidized fertilizer for sugarcane farmers, an additional 500,000 acres that has been brought under production, and improved management of the sugar sector, which have revitalized production and brought the industry back to life. I just signed, as you know, the new sugar laws to provide further policy guidance as we seek to be a sugar exporting country shortly. In the coffee sector, we are on track to increase exports from 51,000 metric tons this year to 150,000 metric tons by 2027. The government has also raised disbursements from the Cherry Advance Fund from 2.7 billion to 6 billion Kenyan shillings, complemented by an additional disbursement of 1.5 billion by the Commodities Fund. Average prices at the Nairobi Coffee Exchange and emergency services are also slowly but surely being made available at no fee. Under Taifa Care, we have introduced a comprehensive benefits package that brings specialized care, such as cardiothoracic surgery, within reach for many Kenyans without the burden of financial strain. Through the Digital Health Act, we are revolutionizing healthcare delivery. Every step of the process, from registration, eligibility checks, to claims, is now digitized. By eliminating unnecessary human interaction, we are tackling corruption, reducing inefficiencies, and ensuring that resources are used where they are needed most. As a result, the good news, SHA will pay all October claims in full by next week. And it will continue like that going into the future. To date, over 15 million Kenyans have enrolled in Taifa Care, and more than 60% of employers have successfully transitioned into its framework. The newly established Social Health Insurance Fund empowers citizens to contribute towards accessing a broad range of healthcare benefits. This represents a seismic change from the old reactive healthcare model to a forward-looking system that prioritizes prevention and preparedness. Once the transition from NHIF is complete and SHIP becomes fully operational, Kenya will have a healthcare system that guarantees dignity, peace of mind, and equitable access for every citizen for the very first time in our 60 years of independence. Honorable members, we have launched an ambitious healthcare program, one that Kenya has always needed and deserved. Like any major transition, there are challenges, but I promise you, we are fully committed to making the system work. As we roll out this program, we are listening to citizen voices and collaborating with counties to deliver better healthcare services. Through the Facility Improvement Fund, which you in this House passed, we will ensure that hospitals are equipped with the tools they need, medicine, equipment, and other resources necessary to provide quality care, while involving citizens in decision-making at every facility. We are now doing the heavy lifting, clearing decade-old debts, ensuring access to medicine and equipment, and stabilizing a system that had failed too many for too long. We are building a healthcare system that serves every citizen with equity and dignity. Over the past month, we have disbursed Kenya shillings 5 billion to settle historical debts owed to the public, private, and faith-based medical facilities, some of which have been pending for over a decade. Another 3.7 billion will be disbursed tomorrow. This underscores our commitment to ensuring uninterrupted delivery of healthcare services, and we will continue to clear the remaining balances in a phased-out approach over the coming months. This sustained effort aims to restore confidence in the healthcare system and ensure seamless access of quality services. Honorable members, there is a compelling body of data projecting that not only is the future of humanity urban, but also that Africa has the fastest rate of urbanization. Kenya is no exception, and in fact, many of our counties are urbanizing rapidly. Dear Kenyans, we have a date with an urban future, and the only choice we have is what this urban future will look like. Will it be characterized by decent, dignified, safe, and livable neighborhoods and communities? Or will it be haphazard, unsanitary, unsafe slum dwellings? This is the fundamental question that our affordable housing plan seeks to answer. Kenya has a serious housing deficit, and the cost of housing is beyond the reach of the majority. While the social and economic efforts of this shortage are far-reaching, rent as a component of the cost of living is unsustainable. People are forced to choose between enduring long, punishing commutes to faraway homes or taking up less desirable spaces within reach. Supplying the number of units required to fill the affordable housing gap requires us to undertake construction throughout the country at the rate of 200,000 new housing units every year for 10 years. Many people have asked why they should be interested in affordable housing projects in rural areas. If you look around, you will witness the signs of our urban future.